Nervous system regulation through listening, the science, and applications. This is from Unite Health. The evidence. Together, clinical trials and real-world evidence create a powerful and holistic evidence base for Unite programs. Clinical trials. Unite programs are supported by a growing body of evidence, including high-quality clinical trials published in peer-reviewed journals. The Safe and Sound Protocol, SSP. Research on the SSP has demonstrated significant improvements in social engagement and behaviors, autonomic regulation, sensory processing, and mental health, including reduced symptoms of anxiety and depression. In 2 sequential randomized controlled trials with parallel control groups, groups with autism demonstrated significant improvements in hearing sensitivity, spontaneous speech, listening, and behavioral organization following the SSP, with benefits in hearing sensitivity and emotional control sustaining in the second trial compared during the SSP to unfiltered music. Another study exploring neural mechanisms of the social engagement system found that children with autism who experienced the SSP demonstrated significant improvements on the filtered words and competing words subscales of the SCAN-3 test, a measure of receptive language, ability to decipher human voice from background sounds, and dichotic listening, both ears. Following the SSP, scores of the group with autism were no longer different from typical peers in the control. Further, the resting respiratory sinus arrhythmia, RSA, increased in the autism group after the SSP, demonstrating improved autonomic regulation. A single subject case study describing the delivery of the SSP to a 20-month-old girl with autism found significant differences within the categories of language, facial expression, listening and processing, emotional regulation, and behavior. During the post-3 months phase, the mother reported that her child demonstrated better listening, social referencing, and turning and smiling in response to her name. Further, an exploratory pilot study delivering the SSP to adults with autism through a hybrid model at home and within an inpatient clinic showed significant improvements in social awareness. Another case study published in the Harvard Review of Psychiatry found that the SSP led to meaningful improvements in a 10-year-old girl with functional neurological disorder who was unresponsive to standard interventions. The participant presented with significant challenges, including unsteady gait, blurry vision, periods of confusion, headache, back pain, nausea, functional seizures, suicidal ideation, and difficulty with swallowing. These symptoms persisted during a hospitalization within an intensive mind-body program. And as she participated in the SSP, her capacity for communication, social behaviors, and physical movement improved significantly. She returned to walking, climbing, and playing, and her breathing slowed, and catastrophic thoughts settled. And she was able to return to school. Further, her functional seizures were reduced, and she and her parents were able to identify early warning signs and implement aversion strategies. During follow-ups, 2 months and a half a year and a half later, these benefits, alongside her sense of well-being, were sustained. In a case report of an adult woman with depression, Burns reported that depression symptoms significantly improved after a combination of body techniques and the SSP. Improvements in sensory processing functions and further demonstrated in 2 studies. In a prospective single-arm study, Hellman and colleagues in 2023 found significant improvements in auditory, tactile, and visual processing alongside digestive function and selective eating in children and adults with autism following the SSP. Kykatokov and Ackerman, 2023, evaluated whether the reduction in hypersensitivities observed by Hellman and colleagues was mediated by the participants' language ability. They categorized participants into groups based on language skills and analyzed their scores on the Brain-Body Center sensory scales, BBCSS, before and after SSP. While language ability was not related to baseline hypersensitivity levels, the effectiveness of the SSP in reducing auditory and tactile hypersensitivities was moderated by language ability. Participants with age-appropriate language skills had the greatest improvements, while those with limited or no verbal skills exhibited a high correlation between pre-post SSP tactile and auditory hypersensitivity levels, demonstrating a more predictive response dependent on initial pre-SSP levels. A recent publication by Groton, Brazier, and others in 2024 found that speech therapy clients with breathing, voice, and throat complaints presented with higher scores of autonomic reactivity associated with lower parasympathetic activity and less nervous system adaptation in response to challenge compared to control participants. A subgroup of 33 clients with self-reported voice, throat, and/or respiratory complaints demonstrated a significant decrease in anxiety, depression, and autonomic reactivity after completing the SSP. These findings help us understand the neurophysiological mechanisms that may underlie medically unexplained otorhinolaryngal symptoms and the potential impact of interventions that target this social engagement system. In a non-invasive listening therapy, the SSP is very low risk, especially compared to VNS devices or pharmaceutical interventions. Notably, no adverse events have been reported by participants in any of the clinical trials. In one study, SSP participants reported mild temporary side effects, including headache, sleeplessness, and fatigue, which did not limit or disrupt program completion. Clinical trials on the Safe and Sound Protocol, SSP, have demonstrated significant improvements in the following areas: social engagement, spontaneous speech, listening skills, behavioral organization, receptive language, social communication, and social awareness, autonomic state regulation, vagal tone, heart rate variability, HRV, emotional regulation, and emotional control. Sensory processing, hearing sensitivities, visual sensitivities, tactile sensitivities, selective eating, digestion, physical movement. Mental health, stress, depression, and anxiety. The Integrated Listening System, ILS. The results of data collected on the ILS have found improvements in social engagement, autonomic regulation, mental health, and functional skills. In a pilot study exploring the effects of the ILS on individualized parent goals for children with sensory processing impairments, Schoen and others in 2015 facilitated a single subject, concurrent, multiple baseline, repeated measures across subjects A/B design with 7 children. Following participation in the ILS sensory motor program alongside visual, motor, child-selected, and creative and/or relaxing activities, participants demonstrated significant improvements in progress towards goals, arousal, and behavior. 23 out of 28 goals demonstrated a positive change, which was sustained or improved. 4 of the 7 participants had a reduction in arousal, with 3 of the 7 demonstrating changes in arousal in response to sensory challenges. Improvement across all scores and sub-tests of the Adaptive Behavior Assessment System were reported, with statistically significant changes in communication and self-care, and significant changes in internalizing behavioral symptoms index. Further improvements on the behavior assessment system for children were reported, including in hyperactivity, aggression, anxiety, depression, atypically, adaptability, and activities of daily living. Parents reported functional gains, including his rating scores came up 4 levels. Her face seemed more animated. She's able now to joke with others. He sleeps better. He picks up on sarcasm more quickly. He's happier at school, and the legibility of her handwriting improved. His behavior in school is better. Another study exploring the effects of the ILS on individualized parent goals for children with sensory processing impairments found improvements in attention and auditory processing. Children with autism received combined ILS and sensory integration SI therapy with the following results. Pre-testing. 0 of the 29 children had intact vestibular processing skills. Post-testing, all 29 were within normal limits. Pre-testing, 28 of the 29 demonstrated ocular motor deficits in the areas of visual pursuits, saccades and convergence, divergent skills. Post-intervention, 25 of the 29 demonstrated intact ocular motor skills. Post-intervention, 22 of the 29 children had auditory processing skills now within normal limits. And pre-testing, 7 of the 29 children began this therapy on medication for attentional concerns. Post-testing, the medications of all 7 had been discontinued. Further, the authors administered the auditory brainstem response, ABR, an electrophysiological test similar to the EEG that measures neural integrity and shows if the ears are coordinated well at the brain stem. Pre-intervention, 29 children had little difference between listening with one ear and listening with both ears by neural summation. Post-intervention, all 29 tested in the normal range. Co-author Dr. Werner reported, I have been looking at auditory processing disorders now for 28 years, and until recently, I've never seen auditory processing skills really get better. And they've watched children come in with auditory processing problems and leave without them. Practitioners' perspectives on the impact of the ILS on children with autism are well documented in a survey conducted by Teresa May Benson and Allison Teasdale at the Spiral Foundation. Of 144 responses, 70 to 80% of the responses were in the often and always range regarding the effectiveness of the ILS, with the most frequent changes seen in motor coordination, sensory integration, sensory processing, auditory processing, self-regulation, and the ability to make transitions. The results of data collected on the Integrating Listening Systems ILS have found improvements in the following areas: social engagement, social behaviors, communication, anxiety and depression, sensory processing, vestibular processing, oculomotor skills, auditory processing, binaural summation, listening with both ears, autonomic state regulation, reduction in arousal measured by electrodermal activity and hyperactivity. Functional skills, self-care, internalizing and externalizing behaviors, adaptability, activities of daily living, ADL, language, and academic skills. Rest and Restore Protocol, RRP, as a newly developed listening therapy. Research on the impact and efficacy of RRP has just begun. Unite Health conducted preliminary testing on the RRP with a group of highly skilled and experienced providers between January and October 2024. A pilot group was administered standardized assessments before and after listening to the Rest and Restore Protocol, RRP, and the most prominent effects were observed in measures of anxiety, GAD-7, sleep, AIS, trauma symptoms, PCL-5, and depression, PHQ-9, with the majority of clients reporting improvements on all measures. In addition, gastrointestinal improvements with RRP were reported consistently by participants, with these findings supported by improvements in the digestive problems subscale on the Brain Body Center Sensory Scales, BBCSS. In the pilot group, 68 clients reported significant symptoms of insomnia on the IAS before starting the RRP program. Following completion of at least 1 hour of RRP, 76% experienced an improvement in symptoms. 44% moved from a clinical level to a non-clinical level. This is just 1 hour, at least 1 hour. The average score on the AIS decreased from 10 to 6, and an average decrease of 4 points. In the pilot group, 27 clients reported significant symptoms of anxiety on the GED-7 before starting the RRP program. Following completion of at least 1 hour of RRP, 93% experienced an improvement in symptoms. 67% moved from clinical level to non-clinical level, and the average score on the GED-7 decreased from 14 to 8, an average decrease of 6 points. In the pilot group, 25 clients reported significant trauma-related symptoms on the PCL-5 before starting the RRP program. Following completion of at least 1 hour of RRP, 88% experienced an improvement in symptoms. 72% moved from clinical level to non-clinical level. The average score on the PCL-5 decreased from 41 to 25, with an average decrease of 16 points. In the pilot group, 22 clients reported significant symptoms of depression on the PHQ-9 assessment before starting the RRP program. Following completion of at least 1 hour of RRP, 82% experienced an improvement in symptoms. 68% moved from clinical level to non-clinical level, and the average score on the PHQ-9 decreased from 15 to 9, an average decrease of 6 points.